Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Side effects of disease-modifying anti-rheumatoid drugs. Side effects are for penicillamine or gold. If we use penicillamine or gold in the patient will develop nephrotic syndrome and even pancytopenia is seen in the patient. If the patient for hydroxychloroquine If the patient is on hydroxychloroquine, then the patient develops retinopathy has the side effect because this hydroxychloroquine is toxic to retina, resulting in retinopathy. If the patient is given methotrexate, always you should monitor the liver because it can cause liver dysfunction. It will also cause bone marrow suppression, and this can also result in lung toxicity also. Despite of these toxic effects, methotrexate is used as the first line drug, or most it is the most commonly used disease modifying anti rheumatoid drugs. Then we have sulfasalazine. Sulfasalazine is the side effect of sulfasalazine is skin rash can occur due to sulfasalazine.
thank you and thank you for watching.